This is just the title of the meeting, and as Sam said, that's the name of my book, in case you didn't catch it. We Are Cuba: How a Revolutionary People Have Survived in a Post-Soviet World. My book was launched after many years of a lot of hard work and labour of love. It was launched just as lockdown started. So that has obviously had an impact on my ability to get the book out to the world. So hopefully you'll all leave the meeting today with the link, if not having bought the book. Okay, so I'm just going to give a bit of framing and a bit of introduction before Valia talks more in a more focused way about Cuba's healthcare system and biotech system. The main thing to point out about Cuba's response is its very swift, coordinated, state-led response. So if I'm going to go through a list of things that were done in Cuba, and you bear in mind that these were measures taken between January. Most of us probably admit we had hardly even heard of COVID-19. It was just a small item on the news about some problem in China. Between January and March. March is important because March the 11th is when they had their first domestic case of COVID-19 in Cuba. It was a case of visitors to the island. Okay, so what did they do? Within this, immediately in January, a National Commission for COVID-19 was set up. They also updated their National Action Plan for Epidemics, which they have anyway. The government scientific council began to work on combating the coronavirus. So they weren't dismissive. They took this very seriously. They began also COVID-19 response training for border and immigration officials, so ports, airports, Marines, surveillance at all the entry ports, and they drafted a specific prevention and control plan that was drafted in January. It was in place by February. They sent specialists to China. Cuba has a very good relationship in the field of medical science with China. They sent specialists to go and learn from the Chinese to study the behavior of the virus. So they took it very seriously and with due respect to the Chinese experts. Medical facilities were reorganized so they would have entry points for people who had symptoms of COVID-19 to keep them separate from anyone else and so on. And all staff who work in the healthcare system were trained. And that includes not just the frontline staff, those who are nurses and doctors, but also, for example, porters in the hospital, people who might be in charge of transport for patients. They also received training, and they had a sort of triangular format. So the directors of provincial healthcare services or provincial polyclinics went to Havana, received the training. They went back to their provinces and trained the directors of hospitals and family clinics, who trained their own employees, who trained, down and down and down. So this was all happening before they even had their own first case in Cuba. The government set up a science and biotechnology group. So they have 50-something medical science research institutes. So they all working together specifically to deal with COVID-19, to adapt existing treatments, to work out what might be useful from their existing protocol of medicines, antivirals, and so on, to develop tests, to start work on vaccines, diagnostics, and so on. And from the 10th of March, inbound travellers were tested for COVID-19. So this is all before their first case, right? So then on the 11th of March, they have 3 Italian tourists who are test positive for COVID-19, and they're given healthcare treatment. And immediately, the whole of the healthcare authorities in Cuba kicks into action. So they've been laying the groundwork, and then they kick into action with organising meetings in every neighbourhood in Cuba. So the family doctors are speaking. It's organised through the committees for defence of the revolution, the street committees, get people out onto the street. The doctors explain what the symptoms, what we know about the virus today, what we should look out for, how we should be behaving, and so on. And they start testing. Contact tracing is a very carried out thoroughly and seriously. And they also have isolation centres, which I'm going to return to later. The isolation centres are when someone is detected as having symptoms, they're sent to a hospital or polyclinic, and if that's confirmed, they are sent, even if they're asymptomatic, i.e. they're not feeling sick, they're sent to an isolation centre. We'll come back to that. So those elements there I'm going to pass over because this is where Valia is going to focus her presentation. At the same time, a lot of education programs, daily information updates. Possibly the most famous person in Cuba at this moment is Francisco Duran, who is the leading epidemiologist, the disease control expert, who is speaking daily and giving people updates and so on. There's been a lot of stuff on the news recently here about how, you know, people should be given information about what's happening in their local area so they can make decisions. Well, all of that's been going on constantly in Cuba. On the 20th of March, Cuba entered lockdown, following, you know, most countries did, but they were on the more strict side. So social distancing was obligatory and face masks were obligatory from the beginning in the street. And I think Valia is going to talk about a national movement that sort of developed around the making of face masks. So collective solutions. There were lots of economic and welfare protections that were brought in, recognising the detrimental impact that this could have on individuals. So self-employed people and small businesses were exempt from tax, domestic debts were suspended, utility bills were suspended from April, salaries were guaranteed up to 50% for people who were hospitalised, and social security was enhanced and extended, and family assistance for people on low-income families. So food, medicine, and so on was delivered to people's homes where there were vulnerabilities and they couldn't get out, or they needed assistance with purchasing that. The provincial and municipal defence councils were activated. Those exist to deal with all sorts of civil defence problems, natural disasters. I'll mention those again. And also Cubans developed their own phone app, which has been functioning, I think, since March, where it's a voluntary app that people could log on to and you know, log symptoms for virtual screening. On the 24th of March, Cuba closed its borders to non-residents. This was a very difficult and a very big decision for Cuba, because tourism is the second most significant source of revenue. You have to remember, when we talk about Cuba's economy, that all of its economic decisions and options are determined by a very punitive, very relentless United States blockade. And tourism has because of this become a source of great dependence for the Cubans. But they had to prioritize human welfare over the economy, so tourism was closed down. Those who were Cuban, lived in Cuba, whether they were Cubans or not, were able to return to Cuba, but they had to enter a supervised quarantine under a testing regime with medical assistance there. So now I'm going to move on and talk about, you know, because these things don't just happen out of the blue. Cuba's capacity and its disposition to respond in that way is the result of certain features of Cuban development. And I'm going to quite quickly run over 5 features of Cuba's socialist development, which help us to understand the way that Cuba reacted. And again, the first couple of these are overlapping with Valia, so I'm just going to mention them. The first is that Cuba has a single, universal, free public healthcare system. So it's not a dual-track system. We have a national health service in Britain, which provides still some services for free, but there is a parallel service system, so you can opt out and take private healthcare. So in the case of Cuba, that's not an option. The other important element is the focus on prevention before cure, and the network of family doctors responsible for community health who live among their patients. They provide healthcare 24 hours a day, and it's a mixture of consultant appointments, so people coming into the family doctor and then visiting the family homes. So the idea of doctors visiting homes and inquiring about the health of people in their homes is part of the system. And I won't talk more about that because I'm sure Valia is going to provide you some statistics and outlines, and we're going to see a video as well. Okay, so the second important feature is Cuba's biopharma industry, which is driven by public health needs, not by the pursuit of profit. There are no private interests. There is no speculation involved. Things are produced not to make money on the market, but because they are meeting a public health need. The biopharma sector produces nearly 70% of the medicines that are consumed in Cuba domestically. They have had problems recently because of the tightening of the US blockade by Trump, which has stopped them getting some of the inputs that they need to produce medicines. So we're seeing very worrying emergence of some scarcity of medicines. But in addition to supplying a large proportion of their own needs, they also export biotech products to 50 countries around the world. They also have joint ventures in 9 countries last time I looked in the global south, but I think the number is increasing quite regularly. Okay, so the next feature is the experience in civil defence and disaster risk reduction, which is usually, as I said, in response to climate-related and natural disasters. It is quite an experience being in Cuba during a hurricane. I've been in Cuba during Category 4 hurricane, and it was really remarkable how everybody knew what their role was. If this was going to be a devastating climate event, everybody knew where they should be, who they should be looking after. And the other aspect of this was, it wasn't that everyone was left to fend for themselves. There was a really collective community response. So some people were responsible for taking the vulnerable, the elderly and children into shelters. Other people were responsible for getting out as soon as possible to get rid of deluge and make sure there was no flooding and so on and so forth. And that system, which has been internationally applauded and recognized, I mean, Cuba is regarded by international institutions as a model for responding to these sorts of disasters. It is based on the ability to mobilize national resources to protect human life. That is the priority. And it is achieved because they have an incredible network of grassroots organizations which facilitate communication and community action. I already mentioned the CDRs, the Committees for the Defense of the Revolution, street committees, but there are also the popular councils, which are like local governance. There are the Women's Federation, the university students, who all play a role and they coordinate between them. So it's always this idea of community and collective responses with the attention of safeguarding human beings. The fourth feature is their experience that Cuba has in operating infectious disease controls and particularly border controls. So Cuba is a tropical country. They face many infectious diseases, many of which wiped out by the post-1959 revolutionary government because of its outstanding healthcare system. But in addition to that, for decades, Cuba has sent healthcare professionals to countries which have infectious diseases that have long since been eradicated in Cuba. And at the same time, it has invited tens of thousands of foreigners from those countries to study in Cuba. I'm thinking particularly of the 1970s when, the Cubans were helping in most of the countries in Africa actually to establish public healthcare systems, and then inviting people from those countries to Cuba to study. And the first thing that they had to do when they arrived in Cuba is they'd go to the Institute of the Hospital of Tropical Diseases, the IPK, and they would first of all be tested for all of these infectious diseases and spend time in quarantine. So Cuba already has a well-developed procedure for quarantining people who are either entering the country or re-entering the country. So they knew how to do this. It's something that I've never experienced happening in Britain. Okay, and then the final feature was Cuban medical internationalism, because although we're talking about how Cuba has got COVID-19 under control, we have to recognise its contribution to getting it under control beyond its own borders and around the world in many countries. And I know Valia is going to talk about that. But just to point out, again, this is not something new. This is part of the historical trajectory of the Cuban Revolution, and it's a key feature of it, which is its internationalism. Before the pandemic began, 400,000 Cuban healthcare professionals had already provided healthcare, which is free at the point of delivery, for underserved populations in 164 countries. At the time when the COVID-19 was announced to be a pandemic, Cuba had 28,000 medical professionals already serving in 59 countries when the pandemic began. And most of you will have heard about the brigades of specialists, of disease control specialists and disaster response specialists from the Henry Reeve contingents that they've sent around the world. But the point is also that the healthcare workers they had in those countries have also been assisting with the major healthcare issue in many countries of COVID-19. Okay, so I don't know if you can see exactly what I can see, because I need to move this here, and you can, if you can see is that a hexagon? I can't remember. It's a long time since I did my GCSE maths. But the green thing there, this is in Spanish, but you'll see the total number of deaths in Cuba is 87. Now, I wrote an article about Cuba's response to COVID-19. I think I said at the end of May it was 82. So you can see that for a very long period, the number of people who have died from COVID-19 in Cuba has only increased by a very small amount. And that's why I think it is possible to talk about Cuba having got COVID-19 under control. Not eliminated it, it's still in circulation within the population, but they are using their medicines to certainly control the number of people who are severely affected, and they're being very successful in that regard. Cuba's outstanding domestic and international response really worth some analysis, that a small island nation which has been subjected to hundreds of years of colonialism and imperialism, and since the revolution of 1959 to 6 decades of the criminal United States blockade, which, let's be clear, includes medical equipment and medicines, that it can play such an exemplary role is due to Cuba's socialist system. Why? The collective approach, the community approach, the human development approach, yes, but also because Cuba is directed by a central plan which directs national resources according to a development strategy which prioritizes human welfare and community participation, not profit. So they don't have to negotiate with private interests and corporations and multinationals and foreign investors when they make decisions about how they will take certain measures in the interest of the population, or the cost. They don't have to negotiate with anyone about the cost of sending the Henry Reeve contingents to assist other nations. And those things are driven by ideological principles. And for 40 years, maybe 50 years since neoliberalism set down deep economic and ideological roots, we have been told that only the market can bring efficient outcomes. And what we've seen in the response to COVID-19 in the richest, most advanced capitalist countries has been an utter shambles. But it's not a coincidence. It's not because there's, Wallies in government, which may well be the case, but it is a result of the market-driven system, because what is being proven is that profit-seeking markets cannot mobilize the resources that are needed to deal with this kind of global health crisis. They are incapable of responding in a collective way that puts human welfare first. And so we have to bring into question the very meaning of the word efficiency. And I think that really, when you look at Cuba, not only have they dealt with the COVID-19 outbreak efficiently, but they have also done that under siege, under renewed aggression from the United States, as a country which is really struggling in terms of resources under that pressure. And it really needs to make us think about the role of the state versus the market in development. And I'm going to stop there and pass over to Valia. Thank you. I will stop sharing. I talked about the isolation centres. So this is when people were confirmed. Two ways they were used. One, when they were confirmed as having COVID-19, even if they didn't have symptoms, they were sent to isolation centres. So they weren't just told, stay at home, you know, resolve your own shopping problems. They were sent to isolation centres where they were under medical supervision. And this is a video. This is the other people who went there were those who were entering Cuba. Okay, and this is the case of this woman. Off you go.
My name is Monica Rivero. I'm a Cuban journalist and I was studying in the United States, and because of the coronavirus crisis I decided to come back to Cuba.
I was taken to these students' dorms south of Havana with more than 200 other people.
We are coming from United States, Dominican Republic, Turkey, Canada, Spain, Italy.
Vengo de Italia y veía cómo morían las personas, 700, 500, 600 diarios. Decidía quién vivía, quién moría.
Sinceramente yo me siento más segura aquí en mi país.
Everybody has felt pretty confident in the health system because with all the limited resources we have, Cuban doctors have more experience working in hard situations.
Mira, cariño.
Gracias. The doctors and nurses are really nice. They change your mask, they check your temperature 3 times a day. There is not much to do here. Mostly people spend time on their phone, they read, they talk about the crisis, they follow the news. Some walking around just to keep moving. You have funny things like the guy who knows his family is waiting for him to put him in charge of all the shopping. So he says, I'm fine here, I don't have any worry here whatsoever, so I'm good, I'm not in a rush to leave. It's something very surprising how close people have become in the only 2 weeks. I've been in a room with other 3 women and we consider ourselves friends now.
Me siento bien porque ayudaron a mis cubanos. No me pongo a llorar porque voy a aguantar. Lo estoy haciendo por ustedes. ¿Ok? Los quiero. Muchas gracias. Estoy hablando con el corazón.
3 days ago we did the test. Everyone was negative. Still we were instructed to finish the quarantine.
Every night at 9 p.m., like in the rest of the island, everyone in the center claps to give thanks to the doctors. The biggest applause was the day before we finally went home.
So I am going to talk a little bit about some things that Helen has already mentioned, but before I want to start giving you a picture of how the health system in Cuba is organized, because the success in Cuba in handling COVID-19 has not been just a coincidence. It is based on the infrastructure that Cuba has been building over the years. So, as you know, the resources in Cuba are centralized, and then the government gives the public health ministry the resources, the money that they need to spend at the different levels. So we have 3 levels of organization. So in the 3rd level, we have institutions that are national dependency, like research and medical institutes and very high specialized hospitals. We have a second level of attention of care that are at the level of the different provinces in Cuba, where also you have hospitals, and they are subordinated to the provincial health authorities. And then you have the third levels of care that are organized at the level of the different municipalities in each of the provinces, where also you have hospitals, and there you have also the health communities, the health area, and the community. Under this level, you have polyclinics, and these polyclinics they offer ambulatory assistance to everybody, to the population. So they are organized geographically in the different geographic areas. And under them, you have the family medicine. And also in the first level of attention, you have other municipal units that I'm going to talk about later. So here, under the first levels of attention, of care, they are paying attention to residents according to the geographic area. And here, at the level of and also at the level of the province, and in the third level of attention, they take care of everybody according to the needs. So this is the organization of our health system. So in general, in Cuba, we have 150 hospitals and 449 polyclinics organized in that way, I already explained. And under them, we have about 11,000 family doctors' offices. At the level of the municipality, then we have other units, like maternal homes, where they take care of pregnant women that they present some type of risk. We have elderly homes and grandparent houses. See, these grandparent houses are social places where they, besides socialize, they also enroll in rehabilitation and exercises programs. We have psychopedagogic medical centers, blood banks, and then about between 12, this is a statistic 2019, so we have 12 medical and research institutes that they are specialized in the different medical specialties. So in that way, we have the Neurology and Neurosurgery Institute, we have the Endocrinology Institute, is one that I am showing here, that is Cardiology and Cardiovascular Surgery Institute, and so on. And in this institute, they pay medical attention to people, but also they carry out research. As Helen said, the Cuban health system is universal and free, and also provide a full coverage, and he is focused more on prevention than in cure. Also is regionalized, as I already explained, by geographical areas, and is based primarily, because of that, in the primary health care, in the community practice, and also have an intersectorial approach. The system has a very tight interrelationship with other sectors and organizations, as the biomedical sector and the scientific sector, that allows that everything that is developed here is immediately applied in the Cuban health systems and in the other way around. The different projects and scientific projects that are carried out, they are responding to the needs of the Cuban health system. What we do in Cuba is apply research. We do a very small percentage of basic research, and the basic research is also with the final goal is always to have an exit that could be later applied or translated to a medical or for a solution of a medical problem, or in other type of research to a social problem. And in the middle of all this, you have the community participation, a participation that also is established through what we call mass organization. I don't know whether that is a correct translation in English. This is a people organization where you have the CDR, the women's organization, all of them at the level of the community, at the level of each of the neighborhood. So this system has an influence that today the main causes of death in Cuba are non-transmissible diseases. Like, sorry, this is in Spanish. I didn't have time to do a translation. Like heart diseases, cancer, and cerebrovascular diseases. Those are the first three causes of death in Cuba in the last and for more than five years. So, as also you know, probably most of you know, the population in Cuba is a little more than 11 million. For those 11 million people, we have been training and more than 97,000 doctors, of which more than 47,000 has been trained as family doctors. Of them, 26,000 are still working in the community. Why 26 or 47? Because after they are family doctors, they could also, after some year, be trained in another specialty, and they don't work anymore at the level of the community, but they are more specialized. But of those 47, 26,000 are still working in the family medicine practice. And we have more than 84,000 nurses. So these human resources, that is one of the principal, how can I say, is a treasure for Cuba. So Cuba treasure more is the human resources that we have and that we have been training over the years. So we have organized this program that is the family doctor and nurse program that they work, and that is called a basic work unit. This basic work unit is a focus in the three different levels: in the individual, in the family, and in the community, taking into account the environment. And then different programs are implemented. We have a very complete vaccination program that all children in Cuba are vaccinated. That is a reality that is different to other countries, and that is one of the reasons that many infectious diseases, transmissible diseases, has been banned in Cuba. But it's also addressed to the family and to the community. To the community with training program, with outreaching the people. That is another characteristic of this program. It's not only a doctor that is sat all the time in a practice, but it's a doctor that goes to the community to look for the patient. And this system is organized in a way that the population is classified, and every doctor in his community knows how many diabetics, how many hypertensive, how many people with different chronic diseases they have, how many pregnant women. So each of the child in which age group they are, and so on. And they deal with other social problems like attendance to the school, families with social dysfunctionalities, and so on. In general, we have in Cuba more than 11,000 basic work units, in which they are working 26,173 family doctors. So, besides that, as Helen was mentioning, Cuba has been exercising the international medical assistance or collaboration. So the first medical brigade was sent to Chile after a earthquake in 1960. And in the 1962, Fidel announced in a speech that he was giving to the medical students in the medical school Victoria de Girón, the decision of the government to offer free medical assistance to countries that need it. And in the 1973, the first brigade went to Algeria, and 56 doctors stayed for 14 months there treating patients. So that was the beginning of Cuban medical internationalism. So here I wrote, so for you, if you are interested in the different decades, in how many countries Cuba has been paying, giving medical assistance for free in this, as a, in a way of solidarity and as a medical internationalism. However, in the 90s, so Cuba has to face another context. And was the collapse, as you know, of the socialist bloc and the disintegration of the Soviet Union, with whom Cuba has the main market. So Cuba enters in a special period that was also tightened, but an upsurge of the US blockade to Cuba. That put Cuba in a very difficult situation, and then the international help started to decrease, and a new program started that was the compensated technical assistance and direct contract. And I'm talking about this a little bit because these issues has been a little polemic during the COVID-19 pandemic, with Cuba doing collaboration, and has been used by Trump government to attack Cuba. So I want to explain this a little bit in the way that everybody understands what is going on. So as I was saying, because of this adverse economical situation, is that the compensated technical assistance and direct contract started, where the doctors were paid a little bit of money, and the rest of the money was going to support the collaboration and also the sustain of the Cuban health system. So in 1998, if maybe you don't remember, but I think even United Kingdom was harmed by this. So we have the Hurricane Mitch and the Hurricane George, two very bad hurricanes that in which many people died in Central America, especially in Honduras and Nicaragua, and caused damage over $6 billion. And also we have the Hurricane George, also causing more than almost $14 billion damage that affected mainly the Caribbean island. So given to that situation, the countries in the area started to ask for help. And then Cuba, as in response to that, canceled the debt to Nicaragua that was over $50 million and offered medical and paramedical help, and also Fidel asked to the international community to contribute with equipment and medicine, while Cuba was providing the human resources of the medical assistance. So that was like in different moments during November and December, different medical brigades flew to Guatemala, Honduras, Nicaragua, and Haiti, providing medical assistance for free. So then, with the time, about that time in the 98, 92, with the special period and the disasters in this area because of the hurricane, so was when I started the comprehensive health program that we call in Cuba Programas de Atención Integral, PIS, that started in November 1998. The principle of that program, where we provide free medical assistance to countries, are sending medical professionals, and health technicians for free that are, this help is mainly in the primary care, and this doctor only receives pocket money by the countries where they are going, while they are providing free assistance and attention at the point of care. So they work in rural areas that are remote. the difficult access, deprived of medical assistance forever. Most of them, they have never seen a doctor. They work, however, under the country law and without intervening in political issues. So the first comprehensive health program was established in Central America and the Caribbean, and later was extended to Africa and the Pacific. And as a support of this, in November 1999, the Latin American School of Medicine was created to make the program more sustainable and able to continue on time. It's in that way that this is a statistic of 2019. Under this comprehensive health program, or PIS, we are providing free assistance to these countries in the Americas, the Sub-Saharan Africa, and the Southeast Asia and the Pacific. And this is free, and this is today. Besides the establishment of this free health medical assistance program has made a big impact in some of the country. For example, this is the child mortality and the maternal mortality in some of these countries. Sorry, again, the slide is in Spanish. For example, you can see here in Gambia how the child mortality dropped, and this is per 10,000 childs. From 121 to 61, and in Ghana for 66 to 10, and so on. And in the case of maternal mortality, again, you can see here the case of Ghana, and even the case of Haiti, with the maternal mortality have decreased in more than, in almost half. So together with this, Cuba has been providing help in natural disasters for many countries for many years. From the 60s, with the first help that I already explained, to Chile because of the earthquake, until the 2000s with the different, with the dengue pandemic also in Central America. And all this medical help, Cuba has sustained it for free. So in 2005, then the Hurricane Katrina happens, and Fidel, that always has been the leader and a visionary, proposed to create an international brigade of doctors that could be specialized in disasters and serious epidemics, and they were trained for that in a way that they were already ready at the moment when this natural disaster happened. So in 2006, this brigade was put together and as a way of offering help to the United States, help that was not accepted, of course, unfortunately. Today, this brigade, that is the Henry Reef Brigade, that is called International Medical Brigade Henry Reef, is composed by 10,000 members, and more than 4,000 of them has assisted different disasters in Guatemala, Pakistan, Bolivia, Indonesia, Mexico, Peru, and China at different moments. Here you have the statistic of how many collaborators, how many of them has been doctors in each of these countries. But also they has been working during Haiti earthquake in 2010, and during the cholera outbreak that happened the same year, with more than 900 collaborators. So Cuba has been one of was sustaining the biggest collaboration with Haiti during these two disasters. And of course, all of you know the participation of Cuba during the Ebola epidemic in these three countries, Guinea, Liberia, and Sierra Leone, where Cuba sent 256 volunteers in 2007. So besides that, Cuba sustained the medical cooperation that I already said. This medical cooperation, doctors perceive a salary, keep their salary in Cuba while they are working to work abroad. They receive part of his compensation in hard currency, and another percent is received for the country that is used to be reimbursed in the Cuban health systems and in other areas. And I believe and I defend that it is fair, because if some country has the money to pay for the Cuban cooperation to a country that is struggling for surviving, but it's fair to do it. But those countries that doesn't have the money still receive the medical cooperation for free. So today, medical cooperation is covered through this modality, the comprehensive health program that is free, the remunerated technical assistance. We have different programs that I have not mentioned that Cuba has established, that started with Venezuela and then has been expanding to the Caribbean and Africa. But we also offer medical education and training, and then we have the Henry Reef Emergency Medical Contingent or Brigade that also offer free assistance during the disaster. But Cuban medical assistance goes beyond that. Also works in epidemiological control in the country where they go, in sanitary campaigns and vaccination. They train staff. They do consulting, local consulting, but also they offer consulting through the whole World Health Organization and the Pan American Health Organization. And they also do postgraduate and undergraduate teaching. So that was the scenario when we had the first SARS-CoV-2 case in March 2020. A population of 11,000 with this amount of doctors and about 62,000 students in the medical school. At the same time, we have 32 pediatric ICU, 27 medical surgical ICU, 39 general ICU, and 120 municipal ICU, that mainly what they do is to offer emergency care for patients that arrive, and then they transfer patients to a more specialized ICU like this one. So it was good, but not enough for facing a pandemic where you have 11,000 inhabitants. So still, Cuba needed to take other measures to be able to face the pandemic, because even with a very good health system, it was facing the possibility to collapse. It's in that way that Cuba started to apply the experience that Cuba has in epidemiological vigilance with active screening, an active screening that was door to door, reaching people in their houses, and also applying contact tracing. And so a person was suspicious or a patient was diagnosed with COVID-19, and starting from that point, the system was tracing the family doctors, and the team was tracing all possible contacts of that person, and also doing border vigilance. And these programs, active screening, contact tracing, and border vigilance, as Helen said, were not new for Cuba. We have dengue. We are paying assistance also in Central American countries where they have faced Zika and chikungunya. We are going to Africa also, where our collaborators are facing other diseases like malaria that is banned in Cuba. So you have also tuberculosis, many other programs. So we needed to keep constant border vigilance and contact tracing. The experience of contact tracing was also very important and developed when the AIDS started, the epidemic of AIDS started in the war, and of course, Cuba was part of that. So also tracing all possible contacts of people that were detected that infected with AIDS. So with that, Cuba also implemented isolation. Isolation that was stratified, was not the same, the isolation for people that were contact, that for people that were suspicious, that for travelers. So we have different centers. We also did isolation in houses for people that were suspicious of probably having COVID-19, and isolation in centers for travelers. And another thing that was very, very important was daily communication with the population. That daily communication with Dr. Duran, that is the director of epidemiology, he sits, and still he does it, every day on TV at 10 o'clock in the morning, informing the Cuban population of all cases. For example, this was today. How many cases were confirmed, who the person is, if it's a citizen, whether it's male or female, how old it is, where in which municipalities is living, whether have condition that is worsening the perspectives of the diseases or not, and so on, and how many possible contacts that person has. And that is informed to the population for each of the person that is detected every day at 10 o'clock, and it's updated. Also, how many people has been in ICU, how many are critical, how many are seriously ill, how many have died. So there is a daily report on TV. There is also a website that this information is uploaded, but also there is a working group. I don't know whether you can see my pointer. Yeah, okay, great. So this working group where the Prime Minister that is here and the President of Cuba is meeting regularly with all the people in charge of the different areas facing the pandemic, from the Ministry of Health to the science sector and industry, regularly, every week. And also you have programs on TV where the president go with the prime minister, and also the different ministries in the different ministries go to explain the population the new measure and what they are going to do. Cuba needs to reorganize itself completely. And then that was affecting each of the different areas of the country. So there is a government follow-up and a coordination of effort that is done in this working group. This today, this is 30th of July, so it was yesterday statistics. So still we have 86 people have died. It has not increased for a while. We didn't have anyone critically ill or seriously ill for many days. So today there is one, unfortunately. And this is the amount of confirmed cases until the moment since the pandemic started. So this is one of the strategies that has been active screening and contact tracing. Please, Jacob, if you can run the video.
Es una enfermedad que está azotando a todos los países en el mundo. Nuestro país no es la excepción. El médico de familia en estos momentos juega un papel fundamental. Vive en la comunidad. No esperamos que acudan al médico de familia, sino que vamos activamente a sus casas. Buenos días. Somos del policlínico. A veces hay alguna persona con fiebre, con catarro, con síntomas respiratorios. Todos estos estudiantes están incorporados a las acciones de pesquisa, tratando de llegar a todos los cubanos en el menor tiempo posible para evitar la transmisión de esta enfermedad.
Los mismos médicos que nos dan clases dicen que es una cosa que antes nunca se había visto. Obviamente estoy preocupada, pero bueno, yo elegí ser médico y es lo que me toca.
¿Tienen más miedo o más optimismo?
Optimismo siempre. ¿Qué clase de médicos seríamos si no tuviéramos pesimismo?
Buenos días, soy la médico sanitario de Nos sentimos preocupados, no hemos llegado aún al pico máximo de los casos. Estamos trabajando para modificar el curso de la enfermedad, identificando al enfermo y aislándolo, y tomando las medidas de prevención con la población sana.
¿Tienes confianza en el sistema de salud de Cuba para poder enfrentar?
Plenamente.
¿Por qué confías tanto?
Porque son los mejores médicos del mundo.
Buenos días, ¿qué edad tienes?
71. yo soy persona de riesgo, ¿no? Porque yo soy asmática, hipertensa. Siempre, los médicos siempre están chequeando, más ahora, y le agradezco muchísimo a ustedes.
Nos hace sentir muy orgullosos que nuestra población sientan que las cosas que hacemos pues les son de beneficio. Realmente esa es nuestra razón de ser.
The students were incorporated to this. At the beginning, there was polemic, and then everything that happened in Cuba is about talking to the population and explaining why to the population. A student needed to go there first because they are medical students. They wanted to be doctors, so they should be part of that effort. And also because irrespective of how good the medical doctors are, the success in the pandemic was about identifying early enough the cases for stopping the transmission. And that is why active screening and contact tracing has been capital, essential in the way that Cuba has faced the pandemic. And that has been different to the UK, for example. And another thing that has been different to the UK also is that Cuba asked the patient to stay at home. They were treated at home, and only when they had symptoms, they were going to the, Cuba asked the patient to go to the health system, to go to the family doctor. Not like here, stay at home, don't go until you have a specific symptom. It was just the opposite, because the system was interested in knowing early enough when patients have very early symptoms. So, okay, no, sorry. Okay, so the program to fight against COVID-19 was structured in this way. So for the healthy people, there was the system was doing active screening, asymptomatic identification, promoting social distancing. If you know Cubans, you know how hard it is for Cubans to do social distancing. So we are a country we are used to live very close to each other and talk to each other. So social distancing has been very challenging, and it still is very challenging, and epidemiologic vigilance. For patients with COVID-19 that were confirmed, they were admitted in the hospital or ICU, depending how they were. And then you have protocol for management and treatment, so that were established. Also, protocol for management and treatment were established at the level of the community for healthy people, and I am going to talk about that later. And then for the recovered patients, they continue the epidemiologic vigilance and the follow-up. But also, okay, as Helen said, we stopped transportation. We closed the border, which is very tricky for Cuba, and we work in the awareness of social distancing. The border closure is particularly tricky because, as Helen said, we depend on not only in tourism, but we are an island. Everything comes mainly through the airport, and the other part comes through from sea via the sea. So that was very tricky. So Cuba was faced with the need, the Cuban government was faced with the need to start distributing everything that was existing in the country, in the different municipalities, in the different neighborhoods, in the way that was accessible to the population, because all the transportation was stopped. People were not able to move from one municipality, from one neighborhood to another one, except using the bike or walking. So it was very hard. And if you have been in Cuba, you know that you struggle. Still, when you have transportation, you need to move a lot to find the things that you need. So it has been tricky, and the government had to deal with that, with distributing food for people in the different neighborhood and municipality, for people have access to the things that they needed. So things that were usually commercialized in convertibles were then passed to Cuban pesos, and even the Cuban the products that were normally acquired freely in Cuban convertible, then they were regulated. Because in the same way that here in the UK, you had people that started accumulating because of anxiety, so the same thing happening to Cuba, or even more, because we are lacking product, and then the border was closed. So that has been very tricky, and it still is very tricky for the government, because the borders are closed. A new measure has been implemented in the last weeks to be able to start recovering from the crisis that the COVID-19 have created. So besides that, phases were established as mandatory, and social distancing is also reinforced by the police, the same way that the face mask is also reinforced for the police, and penalties are imposed to people that don't wear a face mask. Together with this has been several initiatives in the population, because we didn't have face masks. It's not like the Asian country, or we didn't have shops where go to buy this facial mask. And then the community mobilized itself, the civil society in Cuba, to give a response to that need. And then please, Jacob, can you run this small video?
Yo me llamo Evangelina Navalón Ceballos. Yo empecé a hacerlo en Asaúl. Lo empecé a hacer con mis propios medios, pero es fácil en casa. Coge una tela, la divide en 3 partes iguales, la cose en los extremos, la vira, hace 2 pliegues, cose a los lados y busca una tira larga que le coja toda la cabeza, le monta la tira aquí en el medio, cose a los lados y ya está el nazaú. Miren cómo queda. Voy ahora por 255 personas. Priorizo a los viejos. No cobro un medio, no quiero nada de dinero. Feliz me siento de hacer esto.
Together with this, I have to say that not only the community mobilized to produce face masks, but also the private sector helped producing face shields using 3D printers that they already have in the different business. So it has been a combination of the state sector, or the governmental sector, and the private sector to fight together the pandemic. So, but besides that, Cuba also have an infrastructure of biomedicine and science that has been fundamental for facing the COVID-19. So the BioCuba Pharma is we call enterprise, but it's a governmental enterprise under which all the scientific centers are organized. All of them producing different type of products that are supporting the health system in Cuba and the pharmaceutical industry. So as early as in 1960, Fidel said in a speech, when Cuba barely have any scientific infrastructure, that Cuba's future must necessarily be a future of people of science. And that was a premonition, because that is one of the biggest infrastructure that Cuba has and has been fundamental for fighting the COVID. So BioCuba Pharma, with all its centers, is working in 15 projects for COVID-19. 6 are treatment projects, 6 are related to prevention at risk groups, 2 are diagnostic projects, and 1 is a medical device. 9 are undergoing clinical trial, and 6 are still in research and development phase. There is also other projects that are in early stages, like the unspecific vaccine for boosting natural immunity, and one specific SARS-CoV-2 vaccine that is being developed by the biotechnology center. So when the COVID-19 started, already we have many products that have been developed and approved for human use. So, and what BioCuba Pharma and the different centers did was starting to redirect the application of this product to use it in COVID-19. In a way that there is 17 national products that are being used to help patients, and 2 products only are imported. At the community level, so that is the strategy of care, so they are using active screening, and they are using a product that is a national product that is called Prevengovir. And in social institutions, then, for older people, fundamentally, they are using the biomoduling T that is increasing the immunity in people, promoting the response of the T cells in the body. So here is the amount of people, between brackets, that has been treated with this product. At the level of the surveillance center for travelers, they are using also the Prevengovir, that is the national product, but also the biomoduling for people over 60 years old, and transfer factor that is produced in the biotechnology center for people below 60. This is also for boosting immunity. In the center with COVID-19 suspicious individuals, then they are using antibiotics like azithromycin, and this oseltamivir, that is the name of, that is also commercialized as Tamiflu. So everybody knows this is for influenza flu treatment, and interferon alpha 2V that has been that is produced by Cuba. And then for patients with COVID-19, they are using this retroviral that is imported, that is Caletra, besides the chloroquine and interferon, both produced by Cuba. And in critical ill, then they use other products also produced by Cuba, like the erythropoietin. This peptide that has been proven very good at boosting the immunity, and has been this has been a clinical trial with very favorable results in critical ill patients. That is CIV, that is Biotechnology Center 258. So all these products, most of them, the 17 of them are national products again, and imported, like the Caletra and the oseltamivir. Besides that, we have the Immunisate Center. The Immunisate Center already has a very long expertise developing kits for many diseases, in the way that, besides using the standard way of detecting or diagnosing COVID-19 with rapid tests and antibody tests, Cuba developed a rapid diagnostic kit for testing the immunity of population, so the amount of antibody, the immunoglobulin G that the population has, that is giving you the level of immunity for exposition that the population already has. So that was developed in very little time by this center, again, not by a coincidence, but because it has a long tradition producing other type of kits. So then there is the Cuban Neuroscience Center with a long tradition producing medical devices that is going to have ready for October 2020 100 ventilators for patients, 250 invasives, 250 not invasives. And the problem was that the ventilators that normally Cuba didn't have enough ventilators. It was not able to acquire ventilators in the market, but because the companies that normally used to sell those ventilators to Cuba, they were bought by the US company, and the blockade forbid this company to provide Cuba with new equipment or with spare parts. So Cuba has to find a solution, and that was the task given to the Cuban Neuroscience Center that is also part of the BioCuba Pharma. So then, again, this way of organizing the system, where you have the human resources and an educational system providing the students, you have the technology and the industry, you have already products that are intellectual property, and you have a national health system. The integration of all that what was put Cuba in a position to face COVID-19. So this is how Cuba is in the last month, that is in July. In red, you have the number of deaths that you can see has stayed the same for many days now, so in 86. So you have the number of cases that is still increasing, a very slow rate of increment. In the last weeks has increased a little more because Havana and other provinces has passed from phase 1 to phase 2, where transportation is possible and people are moving more. So now there is a call to people for have awareness about social distancing, keeping the measure for not putting in danger the response that Cuba had so far. And you can see here the number of recovery. In general, the progression of cases in Cuba has been very, very slow. And when then you have the international cooperation, Cuba then started to send brigades for free to different countries. It started with Italy, and from that point, more countries were asking for help. So now we have 59 countries, over 28,000 collaborators helping these countries fighting COVID-19.
This business of forced labor is the functional equivalent of slavery.
Esclavo yo que recibo de mi país todos mis estudios gratis. Esclavo yo que mi familia recibe mi salario completo estando fuera. Esclavo nosotros, esa es la teoría de ellos.
Nosotros lo hacemos voluntariamente. Nadie a mí me obliga a ir a ese país. Cuando otros países del mundo nos tildan como esclavos, pero a nosotros eso no nos importa. Lo de nosotros es contribuir con el mundo, contribuir con la humanidad.
Porque hay otros pueblos que me necesitan. No deben de morir las personas cuando hay profesionales y personas que estamos capacitadas.
Voy porque soy médico. En definitiva, para eso se deben formar los médicos en el mundo, para curar personas. No importa si es en Cuba o en cualquier latitud del mundo.
Eso forma parte del genoma humano de los cubanos y simplemente ayudar al que lo necesite. Yo sé, no era nada más justo que nosotros pudiéramos ayudar a otros países.
So then there is the acknowledgement of the population about the work of Cuban doctors and how the system in general is not only the Cuban doctor, it's how the whole system and the whole country, because it has been a joint effort. It's not fair to say it has been only the doctors. The response of the doctor has been excellent, but all the prevention, the tracing, the response of the biomedical sector, the response of the scientific institution has been basic for the success of Cuba in this pandemic. And I want to close with this video. I'm sorry for extending so much.
¡Viva los médicos cubanos! agradecemos a los médicos porque precisamente nuestros médicos son esforzados, no escatiman tiempo para salvarle la vida a las personas.
Aplausos por su gran trabajo, por su esfuerzo. Es muy grande lo que ellos hacen.
La alegría es la mejor medicina que hay para el ser humano.
Los cubanos siempre estamos seguros de nuestros médicos. No tienen ni los medios necesarios, pero salvan las vidas y están ahí. Muy orgullosa de mis médicos, porque es que son lo mejor del mundo.
100% confianza y seguridad de la medicina cubana, porque el país ha hecho todo y ha gastado todo para que nuestro pueblo se sienta seguro y se sienta fuerte y podamos combatir esta epidemia tan grande.
Great, thank you, Valia. That was a really useful introduction, a really useful speech. The slides were really fantastic. We will be making the video public on our Rock Around the Blockade website and on the Facebook page. So, you know, if you missed any key statistics, then you can go back and see that. I can see that RIA has posted a petition. So we have been, you know, pushing for Britain to collaborate with Cuba on containing the virus, and we've been pushing a petition to the British government. So it would really help us out if you could sign the petition and share it. Okay, so I'm now going to introduce Ed Augustin, who is joining us from Havana, from Cuba. So you've seen some of his fantastic, well, not just his, but the group that he's working with, Belly of the Beast. You've seen some of their amazing videos, and just the fact that, you know, they're on the streets of Cuba and providing that platform for Cubans to speak. So yeah, Ed, we'd love to hear from you for sort of 5-10 minutes, just about your work, about, you know, Belly of the Beast, and yeah, I mean, yeah, take it away.
Yeah, thanks so much for the invite. I just saw the tail end of Valia's talk, which was really good. And yeah, sorry for coming late. Part of that is because I'm a chronically disorganized person, but another part is because I spent the morning running around trying to get antibiotics for my girlfriend, and there aren't any of the. She needs 2 types, and one is in stock at the moment, and the rest of Havana we haven't been able to find the other part, and that is plainly linked to the US sanctions on Cuba. I mean, this is a long-running problem, decades long. I've been living in Cuba for 7 years, and it ebbs and flows. And the state press, to be fair to them, are quite frank with the population on that when they're low on medicines. And now, during a time of pandemic, when, I don't know if Helen or Valia would have touched on this in their presentations, but as a result of the US blockade, humanitarian donations to Cuba, including medicine and face masks and ventilators, haven't been able to get in because of the sanctions. In the time of pandemic, of course, the sanctions adding to the pandemic create a huge economic strain that makes it difficult for Cubans to get medicines, and this is just a very concrete, palpable example of how it affects, you know, someone I know here, and not to make that my excuse for being late, but it kind of factored in. So and I think it's always useful to give concrete examples of how the blockade just makes life more complicated in so many different levels here. Yeah, so my name's Ed. I'm a journalist here. I've been here for 7 years. My journalism, I do both kind of mainstream journalism for The Guardian. I'm their correspondent here. And I do a bit for Al Jazeera broadcast, amongst other people. But I've also been working these last 5 months for Belly of the Beast, which is a left-wing operation. And the idea behind it, the slogan we've got is Cuba from the inside, to tell Cuba's untold stories. And there's a big vacuum for positive stories and real stories about Cuba that are often told by the Cuban state media, but the audience is primarily domestic in Cuba. And because of the limitations they they have financially, and in terms of having a high production polish. There are limitations there. And then you've got dozens of foreign correspondents, but because they respond to other interests, there's a whole host of stories that are either unexplored or underexplored. And we set out 5 months ago to US sanctions on Cuba, which, as everyone knows, I'm sure, watching this, started in the 1960s. So they've been going on for over half a century and have been hugely reinforced over the last 2 years, particularly by the Trump administration. And we're going to be showing that in a series of documentary films entitled Trump's War on Cuba. And it's a bit of a provocative title because it's not really Trump's war on Cuba at all. And he is interested in Okay, can you hear me? Yeah, great.
Go ahead.
So thank you, Sam. Yeah, so that was the focus of what we wanted to do with Belly of the Beast. And then halfway through pre-production, COVID came along, and we just thought that it was incumbent upon us, first of all, because it's the news story of the year by a mile, but also because Cuba's response, as various people have been talking about, and this whole chat is about, has been so unique and special and successful. We pivoted our production to cover that. And in terms of my experience in covering it, sometimes it's frustrating working in Cuba, because Cuba, to simplify, the way I think of it, is Cuba is a country that's at war to all extents and purposes. Sanctions are economic warfare. And so Cuba reacts like a country at war. And over the years, there's been so many planted stories against Cuba. You've got the Miami Cubans with their links to the US state, that there's an awful lot of money, 20, 25 odd million a year, to generate negative stories about Cuba, that Cuba's very on the defensive. It's got its guard up about foreign journalists. So it's very difficult sometimes for us to cover and get the access that we want, because Cubans rightly are suspicious, and as the Cuban state particularly is suspicious about foreign journalists and their intents, because they've been burnt many, many times. So access has been a challenge for us, and that can be frustrating. So we're in a long process of confidence building with the Cubans to get the access that we want. And the sanctions are inseparable from this, because if you look at the Helms-Burton legislation in the 90s, that makes it incumbent on any US administration to get as much information as possible on the operations of the Cuban economy in order to sabotage it. So you can see how that sets up an incentive for any state under sanctions to have its guard up about people prying around. In terms of covering it, we've covered quite a lot, as you saw with the Doctor Speak video. Doctors who are part of the Henry Reed missions, who've been who've been sent to well over 20 countries, Africa, Latin America, and for the first time ever Europe, since the pandemic broke. And covering that, just to be honest, is just been an honor. I don't use that word lightly, and I hope it doesn't come across corny. Seeing this small, downtrodden country being the only country in the world to send doctors, thousands of them, thousands of doctors and nurses abroad, just to bear witness to that and to speak to these people before they go on mission is an amazing thing to witness, and I feel very privileged to be here, because there are other countries that have sent aid. China has sent aid to Cuba, amongst other countries. China's sent some doctors to other countries, but they've sent doctors to train up other doctors. As far as I know, Cuba is the only country in the world to have sent significant numbers of doctors, nurses, technicians to directly fight COVID on the level of patients. And that is just an extraordinary thing, especially when we see how selfish European countries have been, and it's not limited to Europe. And it's amazing to speak to these doctors, because being a journalist here, I find it amazing how much the agency of Cuban doctors is stripped away from them by the media. In other words, we never hear their voice. So we have all of this propaganda campaign driven by the Trump administration about how they're slaves, which is ridiculous. It's a complex, problematic thing about Cubans going away to work. It's as doctors, it's presented in the state media as purely noble and disinterested. Well, I think in most cases it's that there is a real altruism that's alive in Cuba, but also people go to top up their salaries. Of course they do. And there are constraints on movement and things like that when people go. But to say it's slavery is a grotesque lie, and also and they know it. And then on the kind of liberal end, you have this kind of, you know, we see it in the Joe Biden campaign, like, well, you know, maybe it's good in terms of the results, but of course Cuba, all the money goes to the regime anyway, and they're forced to go, and they're just trying to export communism. And it's just very paradoxical that you never hear the voice of the Cubans that supposedly, it's implicit in all the media coverage, that we're supposed to care about so much. So just trying to fill that void seemed very important to us. And then on the domestic response, as Valia was talking about, Cuba's had a huge success. It's, I think, the most successful country in the Western Hemisphere in being able to contain it. And key to that success has been isolation of people who have COVID, but also hospitalization of them. Unlike, for example, in the UK, where you're just, you know, expected to kind of like ride it out in your own house many times, but also isolation of people who've been in contact and who are suspected cases. Now, we showed that in our video about the isolation center, and I think that was we felt it was important to get that covered. And another facet of Cuba's response has been what's called here pesquisar, active screening. And it's been, Cuba has a great capacity, not only the political will to do it, but a great capacity to do it, because it has the highest doctor-to-patient ratio in the world, even when all of the 10,000 or so doctors that are posted abroad subtracted from the total. So if you're the country with the highest amount of doctors per patient in the world, it's about 110, 120 patients per doctor. And there's a huge amount that they can deploy. And these doctors are rooted in their communities. You have the family doctor, family nurse, there's about 13,000 of each in Cuba, who are expected to look after hundreds of houses within a radius of just a few blocks from where they live. So they know their patients, they categorize them into 4 different categories of risk. So when a pandemic comes along, they know who the most vulnerable are beforehand, and they're able, and they have the addresses, and it's incumbent on all doctors, nurses, and Cuba's 13,000 or so, sorry, 28,000 medical students to knock on doors and look for symptoms. And we tried to show this with the active screening video. So overall, it's been, yeah, I felt very honored to be able to cover it and try and shed a tiny bit of light and cover this amazing, amazingly successful, both domestically and internationally, go that Cuba's had at containing, managing, and hopefully in the long term, eliminating COVID. And I think that, yeah, it feels like a privilege to be able to shine some light on it, because it's so chronically undercovered because of political interests.
Thank you, Ed. That was really helpful, really useful, and we've all really enjoyed watching the Belly of the Beast videos. So we're going to move to the discussion section, question and answer section. We've had a number of questions already coming in. I would like to bring in Aristides Hechavarria, who has joined us from the Cuban Embassy in London today. It would be great to hear from you. I also have Netfa Freeman, who's wanting to speak afterwards, and then we have a few other questions from Cassandra, from Scott. So yeah, and just to say, if you have any questions or you want to make a point, please send me a message directly. You can message me as a co-host directly to Sam McGill. I will make sure that your question is noted down, and yeah, we will take questions and also let the panelists come back and speak to them. Thanks. So Aristides, it would be great to hear from you.
Okay, well, good afternoon. First of all, I want to thank you for inviting us to this wonderful activity. I want to thank Helen, Valia, and Ed, because they have made a great presentation with a lot of details, a lot of useful information. In the case of Helen, as you know, it's someone very well informed about Cuba. And in the case of Valia, it's someone with a lot of years, a lot of experience working in Cuba as a doctor. And also I want to thank Around the Blockade because of the great work you are doing to spread the word about Cuba. You know, Cuba, this small island, 11 million people, since 1959, is been trying to develop its project by itself, but unfortunately suffering a permanent aggression by the United States government. And during the pandemic of COVID-19 has not been different. Unfortunately, during this period, the US government is enforcing his sanctions against Cuba. Of course, you know, we have a great capacity, a great capacity of resilience to overcome every obstacle that the United States government imposes us. Now, recently, they are trying to, as other people said, they are trying to demonize the international cooperation we are doing with other countries. I would like to say that in the case of our cooperation with third world countries, that is based on South-South cooperation, that is on the United Nations frame. So what we do with many countries in the South-South cooperation, in a certain way, we cooperate each other. We complement. We work together. For example, in the case of Venezuela, we can share with Venezuela human capital. We have many doctors. We have, it's not only doctors, we have engineers, we have sport trainers, we have many things in the capital field that has been the result of many years formed by the revolution. And in that way, we can share that with our countries, and our countries can compensate that to us with all things they have. That's why, as Valia said, from the very beginning of the revolution until the 90s, all our international cooperation was for free. Of course, during the special period, as she mentioned, we found an alternative. But in the case, for example, of Haiti, Cuba, the cooperation Cuba has with Haiti is for free. It's impossible. Cuba could ask Haiti to pay on what we are doing. And now in Haiti, we have, I guess, more than 600 doctors, specialists working there. Working when the earthquake happened, that moment, there was an attention to Haiti. About that moment, years before, Cuban doctors were there. And when everybody left, Cuban doctors remained there. So our cooperation is not in a situation that we would like to get a benefit of revenues. What we would like is to cooperate. And that's what we have been doing. As Valia said, now we are in 38 countries with 45 brigades. And now those brigades have 3,772 members. So that's what we are doing. We are not exporting the revolution. It's impossible to export the revolution. Probably what we are exporting is the example that what could be done if there is a will to take care of the people. And of course, that's something that the United States government doesn't like, because it's a bad example that we are doing. Imagine an 11 million people on the developed country facing many sanctions, many difficulties, and we are doing this. What could be done in other countries with more capacity, more resources, without the permanent aggression of the United States? But that's what Cuba is doing. That's what Cuba is doing. So thank you again. I won't say anything else. If someone would like to have an explanation of something specific, but I believe that the presentation of Helen, Valia, and Ed was amazing. In the case of Valia, she provided us with a lot of information, very updated with many details. So I appreciate what they did. And thank you again for to rock around the blockade. And for Cuban, in my case as a diplomat, when you go out and you are abroad, and you find in a foreign country people that respect what Cuba is doing, what is the case of rock around the blockade, that's something you feel proud of, and that's something that gives you the strength to continue fighting for what we have, for improving the project we have with many difficulties, but at the same time with many achievements that must be known by the audience. Unfortunately, the big media didn't say or don't say anything about that, but we have to spread the word. We have to say, well, there is a small island in the Caribbean, poor country, but they have this as a result. And it's not said by us, because it's could sound not modest, Cuban, saying that what we are doing. It's said by international organizations. It's said by United Nations. It's said by other people that know what we are doing with a lack of resources, but as a great will to put people in the center of the project, to put people in the center of every action we take to protect our population. Thank you very much, and thank you for the 84 people that are right now at the audience. Thank you.
Thank you very much, Aristides. Yes, you know, if people are able to support us, we have ways that you can donate to Rock Around the Blockade. We are trying to produce another pamphlet, and we produced this pamphlet, The Revolutionary Cuba, The Streets Are Ours, over 10 years ago, and we are now wanting to update it. So we've been working on that. We'd love to produce another pamphlet to get out there and speak to people on the streets of Britain. Again, we've been organising protests against sanctions, picketing petrol stations of Esso, ExxonMobil for their lawsuit against Cuba. And yeah, I mean, also what Aristides was saying about supporting the independent journalism that is actually showing, you know, Cuba as an alternative, showing socialist Cuba and what it is being able to do, going against the flow of, you know, the mainstream media that just, you know, has so many manipulations. And so, you know, you can subscribe to our newspaper, Fight Racism, Fight Imperialism. You can also please support Belly of the Beast so that they can produce their documentary about Trump's war on Cuba. So I'm going to take now Netfa Freeman, who joins us today from the US. He's with the International Committee for Peace and Justice and Dignity, and also the Black Alliance for Peace. So Netfa, please speak. Thanks.
Thank you, Sam. I'm going to be very brief, and thank you. I was asked to do this just to give actually the stark difference between the United States and Cuba. The United States right now, as in stark contrast to Cuba, is the epicenter pretty much, I think only second to Brazil, of the pandemic. And actually not only just the pandemic, but the economic disaster that it's actually buttressing. But actually the disaster is not only because of Cuba. I'm going to just run through these slides really quickly that I have here. It's not, I mean, economic disaster, not from Cuba, that's not what I meant to say. It's not from the pandemic. It's the economic disaster is inevitable because of neoliberal capitalism, and the pandemic is only accelerating that issue. Some basic points that I want to just make and then get off, and if people want to ask questions, is that there's not enough testing being done because of not the gross inefficiency of testing. Contact tracing is really not very possible or being very efficient here. There's a rush to get people back to work at the end of the thing because that's how capitalism thrives. Healthcare is tied to employment in the United States and so if you don't have a job, you know, usually people get their employment benefits, their healthcare benefits through their job. If you don't have a job, then you normally don't have to you can't have health care, or you have to pay for it, and it's too costly in the United States. There's a massive unemployment because of the pandemic. A lot of things had to close down and couldn't withstand the long-term periods of being shut down and actually closed for good. And there's just astronomical numbers of people applying for unemployment insurance. There's a rabbit on the part of the system, the rulers, I call them the rulers, the state and the corporations, a rabbit focus on vaccines to the neglect of treatment. So just trying to, you know, everything's so based on just, I don't know, it's just reaction. But Cuba can have it under control, and not just Cuba, but some other places have had much more success than the United States, and they're not doing it with a vaccine, but there's this rabid focus on vaccines here. And then if they do have a vaccine, they're really already poised and having reports talking about it being accessible to the rich. First, and there, you know, concerns about the rich not really, or other people, most affected people not having it. The economy, I already said that the economy can't really withstand this long close down or partial close down. It's in complete conflict with how capitalism works in terms of this production based on profit. There's two actually needs from the workers who are exploited by capitalists, and the capitalists actually share a need, and that the capitalists want to make money and a profit and the workers need income. Well, in a sense of, it's not a conflict because the workers just need to have income even while there's a close down, so it's not because of the work. And then something's telling me something here. Oh, maybe it's not for me. Move this away from, okay, maybe I'll just be quick because it's saying move the application away from the Zoom, but I can't really do that while this is going. Economic package relief is in IRS is in disarray. The economic package relief that they give to people is not even adequate, but they're about to end it because they just, the system is not designed to give people social safety net things that other countries are. Some industries are even profiting from the situation. Some are in dire straits because of it, but some are profiting, like Amazon, for example. It depends on you know, mailings and, you know, what you call it, when you buy things online, have it shipped to you and all that. That's a big part of that corporation. So they're making millions of dollars of profit off of the situation here. Jeff Bezos, the private profit, but other industries and other work things are struggling, particularly small things. Black and First Nations people, working class people are being grossly affected by this. There's a lot spike in the number of, I mean, it's just so crazy in terms of how many people are dying. They started talking about it before in the beginnings of it, but now the media is doing a strange thing where they're not really talking about these very stark realities for people. They're talking about some things, but the reality they're really trying to play down. There's a lot of political posturing going on by politicians, the Republican Democratic Party, trying to use the situation to benefit themselves in the election time. There's a lot of there's a culture of selfishness and individualism in the United States. Their interpretation of freedom is so skewed. They have the precautions that we need to take. That's just messed up slide there, that people need to take are not being abided by, like masks and things like that. The social distancing, a lot of people are seeing that as infringements on their right. And so that's what we're facing here. That's just a really brief sketch. There's a whole lot more that I could tell. As a lot of people know, there's been an uprising because of the police killings and whatnot. And so there's the pandemic has actually accelerated and made a very acute, the class dynamics, race class conflict in the United States. And so that's what we're facing right here. And I'll just stop with that. Thank you.
Thank you, Netfa. You have our solidarity from here in Britain. Many of the comrades here in different cities have been participating in weekend after weekend after weekend of Black Lives Matter protests, trying to get the word out there about what is happening and what continues to happen in the US, because our media has gone very quiet about it, and also about the same issues that crop up in Britain with, you know, the amount of deaths in police custody, and yeah, so, you know, we are absolutely in solidarity with you, and it's great to have you today. So I have a few questions now. So I have a question from Scott about about journalism, and that's, I guess, directed to Ed. And also one from Candice about how the doctors' brigades function, like what the logistics are, and one from Cassandra about interferon and some of the differences about those. So I'll take all of those questions together, and please message me if you have a question that you want to ask. I know there's a couple of other people who've requested to make points, and then, you know, we can go back to the panelists. So yeah, Scott, take it away.
Hi there. It's just a question for Ed. Just how does he feel as, you know, an honest journalist when reading some of the, well, quite frankly, hatchet jobs that have appeared in The Guardian regarding Cuba?
Thanks very much, Scott. Candice, do you want to ask your question about the doctors' brigades? I'll just give Jacob a minute to unmute.
Can you hear me?
Yeah, go ahead.
Cool. So I just wanted to say that I wanted to ask about how the logistics of the international brigades work. I've been reading the We Are Cuba book, and I understand that students of ELAM are obligated to work in the communities for free or in other impoverished places, but there's no mechanism to actually enforce it. So are the doctors that go on the international brigades, are they volunteers? Are they paid more? Are there like targets for the number of doctors that go on the brigades, and how are they met if there are? Just like a bit more details on the logistics, if that's possible. Thanks.
Thank you. Cassandra, do you want to ask about the medicines question you had?
Yeah, I want to say thank you first of all though to the speakers. They were fascinating. All the talks were so interesting. I learned so much. I have a question for Valia, and I was just wondering what the differences are between interferon alpha that is being, you know, used in Cuba, and interferon beta, which obviously has been used in Britain but is now come into the spotlight with coronavirus. And I was just wondering if you could like elaborate a little bit more on what those differences are. Thank you.
Great, thanks. Well, I'll return to our panelists now. Just if you do have a question, please message me in the chat, just explain what it's about, and I'll make sure I take it for the next round of questions. So Ed, if you're still with us, do you want to address the question about the journalism?
Yeah, can you hear me?
Go ahead.
I'll get to the journalism. Just the second question about the logistics, very, very quickly. Nobody in Cuba, no doctor, is obliged to go on the mission. In fact, the missions are oversubscribed. I know people who don't like the Cuban Revolution that live here, that criticize the government, that feel that they're not. They've got lots of other criticisms. Travel. Sometimes, a minority of times, I think in Brazil, you had less than 10% of the doctors in the end staying and trying to live on in Brazil. Sometimes it's as a route out of the country, but that's, you know, less than the rate of desertion, as it's called here, is actually quite low. And I think, frankly, most of the time it's to top up their salaries, because Cuban doctors, although the Henry Reeve Brigade doesn't charge, those on the Henry Reeve Brigade do earn far more money than they do back home, and that's a legitimate thing. Like, I don't think, but personally, I'm firmly on the left, but I don't think we should be bashful about talking about money as something that is useful to us, and as a Brit, you know, born into, you know, middle class Britain, Cuban salaries are really, really tight, and they're particularly tight because of the blockade and Cuba's choice to ensure that the social services are still there post the fall of the Soviet Union. They've had to, you know, 2 + 2 is 4. They've had to repress salaries in order to square that circle. And my main point here is that makes even more of a laughing stock out of the idea that they're slaves. They're I mean, this is like really vulgar propaganda, and people want to go so much that there's even often like low-level bribery of like, I'll give you $20 or 20 cook if you can like put me up the waiting list. Hugely oversubscribed, and you don't have to go. And those who go come back for holidays. My understanding is it's 1 month every year. They come back. That's all included. And if you've got a personal reason where you're 2 years in or 6 months into a mission and you don't want to do it, you can come back and you incorporate yourself back into the medical system if you want to keep working there. So there's not really, I haven't uncovered in my reporting any sanction for not going along with it, even after you signed up. On the question of the dicey question of being a freelance journalist for The Guardian, I hope that no one, my editor, isn't part of this discussion. Yeah, it's complicated. I think that The Guardian, I mean, I don't feel part of The Guardian. I don't have this like clubby mentality. We at The Guardian. I'm quite, I use it to earn a bit of money, and more importantly, to try and get the information out. Of course, I've got conflicting feelings about some of the pieces they've done about Cuba. I think worse is the coverage of Venezuela in general. Even when things were much better in Venezuela, even when Chavez was, elected again and again and again, any economic indicator that you looked at was increasing. And The Guardian's coverage, particularly Rory Carroll, was just hatchet job, and very well done, but very, very, very well done hatchet jobs that were quite difficult to take apart, because he'd often focus in on things that were true, but magnify them, and not talk about other things that were true that made out that the government was doing a good job. So yeah, I think that I'm working for Belly the Beast now, and this is a group of I'm British, 2 North Americans, and we're collaborating with Cubans here on the island. But we've got a huge problem in terms of getting things out. I mean, we've had to go cap in hand to rich socialists, millionaires, mainly in the US, for funding, and we've only got funding for. I'm not doing this to plug the project or looking for funding, but it's difficult to make it sustainable. And it's very difficult to get them out. I mean, we've got an advertising budget of thousands that we're yet to spend because Facebook blocked us because we're based in Cuba, which we're contesting. But even if they unblock us, we've got to give our money to Facebook, and it's horrible to get it out. Whereas when I do jobs for The Guardian, the last article I wrote about Cuba's domestic response, I think it had 8,000 shares. Belly of the Beast, our videos are getting thousands of views, not shares. So it's orders of magnitude more people I can reach by working on it, which is why I like to work on both. And also, I mean, Al Jazeera, it's Qatari state propaganda. They cut a lot of people's heads off. I think 85% of people living there are not citizens, embroiled in slave labor, building empty skyscrapers. Horrible in terms of COVID. But again, it's a mouthpiece essentially. And when I did a piece for them when the first Henry Brigade left to Lombardy in Italy back in March, and 350,000. So this is 100 times more people than any of the thing what we've done in Belly of the Beast. So necessary evil, perhaps. I'm sure in response to your question, that most people here are as cognizant as I am that there's structural biases in media in every country, including the US. Including the UK. Most journalists are quite posh. People have disproportionately gone to private schools. There's often this kind of like sarky attitude of The Guardian of like, if there's a leader like, Fidel back in the day, or Chavez, who's got popular support, there's often this kind of knee-jerk reaction to kind of like poo-poo them, and they're like, we're far too clever for that. And yeah, I think that all plays into how even liberal or left-leaning domestically in the UK with The Guardian, or left in the UK, journalism, when it comes to Latin America, where there's so little coverage, it's a strategy of legitimation, unconscious, I think, of a way of kind of like shunning and discrediting political projects that have got mass support and are making people's lives better. And I think there's a huge elephant in the room in all mainstream coverage. I don't think British coverage is as bad as US coverage, but it's still pretty bad, which is that though the embargo sanctions, blockade, whatever you want to call it, is talked about, the human impact is never talked about. The fact that it's making, that it messes up everything, that it makes it more difficult to get fertilizers, that if you stop petrol, ambulances won't be able to run, that power cuts make people's lives a pain, and people die. Sanctions kill, even in Cuba, when the country is so adept and resilient at fighting them. That fundamental truth that sanctions kill never gets out. That's the elephant in the room. So I'm trying to kind of walk a tightrope between earning enough money to live, getting the message out, but also working on, projects like Belly of the Beast, whose values I agree with, which I'm more aligned to, but we've got to accept that building this up is going to take a huge amount of time, and the problem of reach in this digital age controlled by oligopolies is always going to be an issue. So maybe that sheds some light.
Thank you very much, Ed. Thank you for mentioning Venezuela. That's something that we campaign on as well. Yeah, I mean, definitely the coverage of Venezuela and Cuba and, Evo Morales' Bolivia, it's all backed that kind of attack on the movement for socialism in Latin America. So I'd like to bring Elias in right now, just to talk about an event that I know is happening in solidarity with Venezuela. And just to say, I mean, I know we were wanting to wrap up about 7:30, and there's a few announcements, and I'd like to bring the panelists back in at the end. If you have any questions, please put them in the chat to me right now. I will let you ask them before we go back to Helen and Valia. So Elias, please speak.
Hello. So as most of you will have heard, the Bank of England is keeping Venezuela's gold reserves in London. I think the value is near to $1 billion, and they're saying that they don't recognize Maduro's government, and these reserves belong to Juan Guaido. But actually, back in 2018, when Guaido was unknown not only in Britain but also in much of Venezuela, they still would refuse the Venezuelan government to withdraw those gold reserves. And as most of you will also know, Venezuela is going through a very tough situation, especially now under US sanctions, which are almost as bad as a blockade. I mean, Assan has put down here, so that's around $1.2 billion or 800 million pounds. And right now there was an urgency to withdraw those reserves to pay for the response against COVID-19, because another fact about Venezuela now is that it's actually had a really good response compared to other countries in Latin America against COVID-19. But it's going to be still they're still having a very hard time. So they do need they need like foreign currency to pay for imports. So the Bank of England, since they're going to hoard all of this gold, maybe even give it to Guaido, and not sure what they're going to be doing with it. So then we're going to have a protest on August 15th, and it's going to be like a physical protest. So that means that on August 15th, as you can see in the link that Cassandra posted on the chat, we're going to be going to the Bank of England in London, and we're going to show them that we're not going to let them get away with it. I mean, essentially they're stealing all this gold. So do send a message saying if you're interested, maybe in the Facebook event. And we also want to prepare a lot of placards and banners and so on. So it'd be really great if everyone can come that comes to this protest. Tell the Bank of England that they're not going to get away by stealing Venezuela's gold, especially now in this with the COVID pandemic. So yeah, we'll expect most of you over there, and we hope that you can come and reclaim this club.
Thank you, Elias. And if everyone could help by liking and sharing the event and getting the word out, even if you're in different countries, please help us to spread the word. Okay, so we now have a few questions. So I'll take these before we go back to the panelists. So we have Shad Ori, would you like to speak?
How are you spelling that? Sorry.
Sorry, C-H-A-A-R-E. I might have
Got it.
written
I got it
wrong as well. Yeah, cool.
Thank you.
You should be unmuted now. You can speak.
Thank you. Can everyone hear me? Right. Thank you so much to everyone. My name is Chand. I am a physician and I'm from Washington, D.C. is where I'm currently located. I did want to send solidarity to everyone who is fighting the war that the U.S. is imposing on people around the world, especially right now, Cuba. Specifically, the questions that we've been having in our community have been around how to adopt these models of care that exist in countries like Cuba in our local communities. It's come to a point where I've had to leave my job at the hospital because I was being threatened for my anti-racist work. And we're really trying to adopt these models of how we can do contact tracing on our own, isolate people on our own, just because there is nothing coming from the government. What are the ways that healthcare workers like me can communicate with either Cuban resources, some way get there? I don't know how that's going to happen, but are there any resources that we can access to learn more and adopt them in our local communities?
Thank you. Hannah, you have a question about the older population. Hannah, sorry, I should have took your surname. Hannah Kalla.
Hi, thank you so much, Helen, Valia, Ed, Aristides, and Letpa. It was fantastic to hear you speak. I feel very inspired. I think the thing that is the most significant for us in Britain is to see the house-to-house visits by doctors and nurses and students, to know that the Cuban healthcare workers know their population and their community in advance of this, and the fact that as Valia said, the Cuban doctors and nurses want to see people rather than this terrible thing happening in this country where people feel to stay at home and turned away and not being able to access healthcare necessarily. And I think the deaths in the care homes for elderly people in this country have been so horrific and shocking. And the fact that now there are some homes who are saying they can only have one visitor for half an hour every week. I mean, we are going to kill people by isolation and psychological distress and mental torture in this country. And it shows what capitalism, how savage and brutal it is. Whereas, as everyone has said, Cuba, led by the ideology of the Communist Party and building socialism, has put people first, and it's inspiring. And I wondered if any of the speakers could say something about what's happening to the elderly population who can't live in their own homes in Cuba.
Thank you. Dani Acosta, you wanted to ask about the US blockade.
Yeah, can everyone hear me? Yeah, congratulations to all the speakers. It's been fantastic presentations. I just want to raise an issue that has been mentioned a couple of times, which is the US blockade. And the US government recently announced sanctions for a Cuban ban in London. And the issue is the extraterritorial effect of the US blockade, that even people from fair countries in Britain and Europe, they get affected. And mainly it keeps happening because there's not a resistance to these punitive sanctions. For example, here in Britain, as a Cuban citizen, when I go to the Cuban embassy to pay for my passport, I have to pay even with a postal order or find a way to pay, because Britain have found it very difficult to provide the Cuban embassy or Cuban business with safe banking. So I wanted to ask Aristides from the Cuban embassy in general, with this persecution against Cuban finance, how is Britain and Europe responding to Cuba? Have they guaranteed that it's not going to confiscate any assets, or things are going to be working by normal? If you have any comments in relation to the blockade, and what can we do as Cuban and also citizens of these countries to prevent bans like HSBC or any other ban imposing these sanctions on British citizens?
Thank you, Danny. Okay, so that's all the questions that I've had. I have got people that want to make announcements, and I will take an announcement section at the end. So on that list, I've got Ria, Nina, and Irene. I hope I've said that right, sorry. Irina Houston. And so I've got you three on the announcements list. Don't worry, I haven't forgotten about you. If anybody else has sent a question to the panelists that I've missed, please let me know now. Otherwise, I will hand it back over to Helen, Valia, and Aristides to address some of the questions that have been raised. One second, I've just seen. Oh, okay. There was potentially a question from Robert. Is that a question, Robert, that you wanted to ask? Oh, and sorry, I did have a question from Maxine. So go ahead, Maxine, if you'd like to speak. Maxine Sadze. And Robert, if yours was a question, indicate now, and I will take you after Maxine.
I'm Maxine, and I'm a biomedical scientist working for the NHS. My question was about treatment, because there's been a bit of controversy about chloroquine, especially that Trump has been advocating it. So I saw that the Cuban medics have been using chloroquine along with other treatments. What has been have they found any adverse effects with patients? Because there's been things like severe headaches, and it seems to have been successful with people who don't appear to have the symptoms, and also with the patients which were not very sick. So if I could just have an answer to that. Thank you very much. And also, thank you for this session, and the speakers have been amazing, and it's been amazing to hear what's going on in Cuba and around the world, and solidarity to all the Cuban medics.
So, Helen, Valia, Aristides, who would like to come back first? I don't know if Aristides, you want to address some of the questions?
There was too many. I don't remember the order. So
Okay,
I will go very quick.
Just answer what you can.
Okay, if I don't remember something, please just remind me. First, about collaboration. I think Ed already addressed that. I want to say that Henry Reef works in different principles than the other collaboration. Henry Reef is free and go to disasters. Some people are members of the brigade, and they are specifically trained to deal with that. So that is a different concept. Depending on collaboration, Cuba likes to go to collaboration, and before that, if they likes to go before, liked to go to international missions, because we Cuban are friendly, we are adventurous. This is one thing. We have this humanitarian side. Everybody that knows Cubans, you know we are like that, but also it's an economical contribution. Even before, during the international mission, even when they were not paid, even the pocket money and the possibility to go to African countries or other Latin American countries open a window to solve some small economical things they didn't have at home. So it's always an opportunity. And with the medical collaboration, it's even better for them, because the government keeps around the 20–15% of what each country is given for each of the doctors, but they kept the rest. And that goes directly to the bank account in Cuba, and the other money they use is in the country where they have. And at the end, they make a good amount of money, and they need it, because it's not a secret that we live in a very tight condition with many economical issues. And that is why, as Ed says, the list for going to collaboration is very huge. People go voluntarily, and they are eager to go, doesn't matter where. Even when they are working in very hard condition, in remote, inaccessible places. So it's a combination of both. So regarding the chloroquine, I already answered something in the chat, but because it came again, so I'm going to answer. So I also had the question, so I was asking some friends in ICU and other doctors working in Cuba. Everybody answered the same. And I saw a paper. I can share it later when I finish about this. So Cuban is aware of the controversy around the chloroquine, but we have a long experience using chloroquine because of malaria. So we don't have malaria in Cuba, but to the countries that we go in Africa and also in America, Central America and South America, they have malaria. So we are used to deal with that, and we are used to deal with chloroquine as a preventive and therapeutic treatment for malaria. So that is one thing. So we have experience using the drug. And right now for COVID-19, they are using chloroquine in very low dosage in patients that don't have complications, and also they don't have important risk. And also at the beginning, so not in patients that are very sick. So that is the way that it's been used in combination with other. And the results speak by themselves. So the recovery is very good, the death rate is very low, there is not important side effect. So that is the Cuban experience with the chloroquine, even when we are still following controversy that is going on in the world about the use of this drug. So the other question was about interferon alpha and beta. So yesterday I was talking with Helen about that. I said, I'm going to ask my technology people because I know someone is going to ask. So the receptors are the same, so, and the signaling response is similar between alpha and beta interferon. In the case of what Cuba has developed is alpha interferon time ago. So this beta interferon was developed by a country that is called Ergin or something like that. This is a lot of money, and the stock market has been growing a lot around this company. This is a lot of money involved. The response is good, but the response of Cuba alpha interferon, it is quite good. There is a 50% of negativation, I can say that in English, becoming negative, patients becoming negative at the 7th day. And when alpha interferon is combined with gamma interferon, the response is even better. There is a 70% of patients becoming negative at the day 7. So we don't have enough patients to do clinical trials because we go to the community and we're chasing people when they start developing symptoms very early on for saying, so that is another difference for comparing the two type of interferon. So we have low cases and we are intervening them very early on in the first stages of COVID-19 when the symptoms are very mild. Mm-hmm. I don't know whether there was something else I didn't answer, so sorry.
No, I think that was the main questions. Obviously, you know, if there's any way where like the US doctors that Chan was mentioning can, you know, relate with Cuba, then maybe if you could send him a direct message, that would be brilliant.
I already did it. I sent him several links of publication about contact tracing in other diseases because it's too soon to publish about contact tracing specifically in COVID-19.
Okay, thank you very much. Okay, so I will hand it to Aristides now, and if you'd like to talk a bit more about the blockade and some of the issues that Danny raised. Thanks.
Okay, I would like to going back to the question about doctors, if they are going abroad, volunteer or not. Let me tell you that it's the same attitude. The doctors now going out is the same attitude that the Cuban people had when we were in Africa fighting against apartheid. So it's completely volunteer. It's impossible to have abroad. Right now we have 28,000 plus 3,772 doctors working abroad. It's impossible to have that amount of people applied abroad. They are doing that as volunteer. Let me tell you something about how we understand solidarity. We understand solidarity and we understand collaboration, international collaboration with other people as a duty. We feel that acting in that way, we are paying a debt with humanity. Our main leader, Fidel Castro, said that the Cuban Revolution was not or will not be alive if we could have international solidarity. So since the very beginning of 1959, we have been working with other people, providing our help. And it's because also there is a reason in the history of the Cuban population. We have received a lot from other countries. Probably you know that in the history of the fight of our independence, we received the contribution, for example, of Che Guevara. He was an Argentinian. So we also received in the independence war against our metropolis, Spain, we received the support from Máximo Gómez, who was born in Dominican Republic. So in our gene as a nation, we understand that we have a debt with humanity. And also our main hero, Jose Marti, said that homeland is humanity. So Cubans, the majority of the Cuban population understand that we have to do something for the rest of the world. It's not, we share what we have. It's not too much in terms of material things, but in other things we can share what we have. So definitely our doctors are going out volunteer. In the case of the question about the sanctions that Danny made, well, let me clarify something. What was published recently with OFAC, the Treasury Department office in charge of the sanctions against Cuba, was an updating. So the bank that was mentioned there, the Cuban bank that was mentioned there, has been in that list since the 90s. Now the US government updated the information of that bank, putting the new address, the new more data about that bank, but the bank has been there since the 90s. So you, as a Cuban, and all of you, if you feel solidarity with Cuba, I believe that you must raise your voice to denounce every action from the United States government against Cuba. As you know, Europe and UK, every year the UN, they support the resolution that Cuba present against the blockade. So that's the position, the official position of the UK government and the European Union. That's the position, and they have been keeping that position against the US will, of course. And now, as I said, what you can do is it's to spread the word, to raise your voice and denounce what is happening. It's very difficult. You must know that financial markets and that banks are mainly controlled by US. So it's very difficult for Cuba to find a way for all its transactions. But we will try to find how to do it. And I guess I heard that Hori, he's from, he's now in United States, right? Hori, he's from United States, or he was in United States, and he was asking how to get connected with Cuba. I suggest those that are in United States to get in contact with the Cuban embassy in Washington, DC. And those that are abroad in our country, I would like to get involved in solidarity with Cuba. I suggest them to get in contact with the embassy of Cuba in the country they are. Okay, that's my
Thank you very much, Aristides. Okay, can I bring Dr. Helen Yaffe to come back, and then we will move to announcements. Thank you ever so much for everybody's contributions.
Okay, thanks everyone. It's been a fascinating discussion, and I've learned a lot. My book, as Candice mentions, has a chapter on Cuban medical internationalism, an army of white coats. There's also another chapter called The Curious Case of Cuba's Biotech Revolution. So I don't claim to be an expert on the difference between interferon alpha and beta. And I was quite pleased, I have to say, when I realized that Valia didn't know until she checked. So, but yeah, you can read more about that there. I mean, I'm really pleased actually with the comments that Aristides made, because I think that sometimes when you live in Cuba, which I have done, and when you are Cuban, you can sort of slightly lose sight of what's exceptional about the way that people think in Cuba, the way that they're brought up, the fact that their first lessons at school, they are taught that cooperation is better than competition. And there is this tradition, a revolutionary tradition, a proud revolutionary tradition of internationalism, which, you know, Aristides was referring to Che Guevara, the War of Independence. Henry Reeve brigades are in fact named after a US, someone from the United States who supported Cuba in the War of Independence against Spain. That's why they named it, because it was a brigade initially set up to help, to, you know, give that help back by helping the people of New Orleans who were being left to drown and die after Hurricane Katrina. So, and that tradition, it's a tradition of like being the young, being revolutionary active, and that we saw with the literacy campaign of 1960, when, you know, 700,000 Cubans went all around the country to teach their compatriots, to teach their you know, people in their country to read and write. And it's that spirit that every generation also wants to be at the forefront of contributing. And there may or may not be a personal material incentive. But the fact is that it is having a planned economy which prioritizes welfare, not private interests pursuing profit, that allows Cuba to be able to reap the benefits of its investment in social welfare. And so when the blockade squeezes and squeezes Cuba and stops it being able to just carry out normal trade, the Cubans had medical services, healthcare services to turn to as an alternative source of income. Yeah. So, you know, it very quickly, with the relationship with Venezuela, became the most important source of income for Cuba. But, you know, thank goodness that they had that, and they had that because they are a socialist planned economy. Every year, the Cubans plan how many doctors do we need, how many nurses, how many anaesthetists, how many, you know, so on and so forth. So none of it's left to an accident. And on this question, I just want to, I don't know if this is cheeky, but I want to read one paragraph from an article I recently wrote for Le Monde Diplomatique on how the world rediscovers Cuban medical internationalism. It says, the revolution of 1959, which shaped the Cuban view of solidarity, combined the values of national independence hero Jose Marti with Marx's analysis of capitalism. Taking up the battle cries from Marti, homeland is humanity, and Marx, workers of the world unite, you have nothing to lose but your chains, Cuba's revolutionary leaders sought to promote a global struggle against diverse forms of underdevelopment, imperialism, colonialism, and neocolonialism. They view global poverty and poor health as a result of these exploitative structural conditions. The post-1959 public healthcare system was constructed on those values. Free universal state provision was endorsed as a human and constitutional right. Cuban medical internationalism is an extension of those principles overseas. The other thing which we haven't, I mean, Valia talked about ELAM, the Latin American School of Medicine. Cuban medical internationalism is not just outwards moving, it's also inwards moving. So it is people coming to study in Cuba. ELAM was one example, but actually tens of thousands of people from Africa and Asia and Latin America had already studied, in particular, well, less from Latin America, from the post-2000 period, more from Latin America. And then there is the treatment of patients. So, you know, we're hearing that, you know, the Sky movie on Chernobyl is winning a BAFTA, or may have won, I don't know what the news was. But, you know, the Cuban contribution in relation to the nuclear disaster of Chernobyl is barely mentioned. And yet, over a period of, bad maths, I don't know, what was it, 21 years, 26,000 people from the region, Ukraine, Belarus, Russia, received medical treatment in Cuba without paying a penny. Without paying a penny. And this started, by the way, at the very beginning, or just before, and continued through the very beginning of the special period. So when, you know, Cubans were suffering from electricity blackouts, when there was hunger, not starvation, not death, but hunger in Cuba, when there was, you know, very little to go around, they still put aside resources to care for people who are from thousands of miles away, who they have no direct material benefit from helping. So, you know, this is the spirit of the Cuban Revolution, and this is the spirit that we need to take on by combating the US blockade. I mean, Aristides was also talking about the UN, that Britain takes a position against the blockade, so does the European Union. Correct, but they don't do anything about it. So there is legislation in Britain, in the, you know, British Parliament passed legislation, European Parliament, and individual countries within Europe, the UN has instructed all member states to pass legislation to say that the US blockade is not applicable to their citizens and companies from that country. And yet, because no court action is taken, those punitive fines and threats from the United States, from the Office of Foreign Asset Control, the US Treasury continue to put people off from engaging with Cuba, from trading with Cuba, from investing in Cuba, and most importantly, in the context of a pandemic, from benefiting from Cuban advances in healthcare and biotechnology. So we all lose out. So I would say to anyone here who's not already involved, if you're in Britain with Around the Blockade, the thing is in the name, yeah, we are, the campaign is set up to combat the blockade, show solidarity with Cuba. And if you're in the US or India, I know there's people here from those countries, then get involved with campaigns in those countries. And you know, we all have to take this on as our fight. Sanctions kill, as Ed said, they kill in Venezuela, they kill in Syria, they kill in Libya, and they if they don't kill in Cuba, it's because you know, the Cubans have made terribly difficult sacrifices, because they have a socialist planned economy that manages to, you know, share scarcity among them. And that is what has kept them alive, and that is what has limited COVID-19 in Cuba during this pandemic. I'll stop there. Thank you.
Thank you very much, Helen. Can we just, sorry?
Just to add something very small.
Okay.
That Britain also have profits from Cuba Solidarity very recently, and that was the Bremen Cruciate. So where many people were abandoned in the middle of the Caribbean, and no one was able in the middle of the pandemic to accept these people because they didn't have the conditions to do it. And starting fighting the COVID-19, Cuba accepted the passengers, and they returned safely to the UK. That is also solidarity.
Yeah, thank you for that important reminder, Valia. The HMS Braemar was, you know, right at the beginning of the kind of lockdown for us, or just before the lockdown. And again, it really shows the difference between the socialist response to COVID-19 and the capitalist response to COVID-19. And you have only to look at the death rates and the economic crisis and the impacts in the US, in Britain, you know, and then obviously the devastating effect on the countries that Britain and the US oppress, to understand, you know, that the fight between socialism and capitalism is a fight for all of humanity. So it's been really, really helpful and useful to hear from all of you today. Thank you so much. Can we just have a round of applause for the speakers? I wonder if Jacob can unmute everyone so you can actually hear. I don't know if it's possible.
If not, you'll have to just, you know, make do with our hands, but everybody's clapping. Thank you so much. Okay, so before we close the meeting, thank you for joining us today. I appreciate we've overrun slightly, less than a Fidel speech, I will say, but we'll just move on to some announcements before we close the meeting. And I will ask the people who've been posting the links just to keep posting everything now, because remember, when the meeting finishes, the chat will be gone. So make sure, if you want to sign the petition to demand Cuba, that Britain collaborates with Cuba, please, you know, take the petition link now. There's another petition there about, you know, demanding that Cuba is recognized as a Nobel Peace Prize winner for its contribution to the fight against COVID. And obviously there's all the links to Helen's book, to yeah, all the different organizations, to the newspaper, to a Belly of the Beast fund. And so please post them now and take them down. So I'll move to Ria then. Thank you for the announcements. If anyone else has an announcement, just message me quickly.
Yeah, mine's not so much an announcement as a contribution, but thank you to all the speakers. I'm a member of the Revolutionary Communist Group, and Rock Around the Blockade is actually our campaign. It's a campaign that we set up in 1995. And last year I was on the brigades that Rock Around the Blockade sent to Cuba, and something that kept coming up from various conversations with Cuban people was that what they need most from us as people that live in Britain is political solidarity, and that means us going out onto the streets and building a movement that is inspired by the example of Cuba and that is based on the principles of socialist Cuba. So that is anti-capitalism, anti-racism, anti-imperialism, and socialism. And that's exactly what the Revolutionary Communist Group is doing. And it's amazing to have this meeting and to have the discussion, and it's good to learn, but we don't just want to know for the sake of knowing and discuss for the sake of discussion. We want to learn this stuff so that we can go out and apply it. And yeah, from knowing stuff, we don't help anyone, we don't change anything. It's actually by going out there and building a movement inspired by socialist Cuba, a movement that can actually challenge the poverty, the racism, the war, the environmental destruction that is part of capitalism. That's what we need to be doing. So yeah, like Helen said, it's up to all of us to build that. So if you're not already involved, if you're not already a member of the Revolutionary Communist Group, then now is the time to join us in building that movement. And you can contact myself in the chat, or Cassandra if you do want more information about how to get involved. Or you can find it on our website, which has been posted into the chat a number of times.
Thank you, Ria. I'll move to Nina from the Cuba Support Island.
Can you hear me?
Go ahead.
Yep.
So this is Nina from Cuba Support Island, CSGI. Thank you so much, Sam McGill. You did a wonderful job there. I'll make it really quick. We love amplifying everything you, all your news and all your events. They're really good. Just a couple of things. So we believe that the recent European Court Justice judgment in the Max Schrems case against Facebook and the Irish Data Protection Commissioner opens up the opportunity to stop EU data being transferred to OFAC in Washington through SWIFT. This is the main financial institution used to enforce the blockade. I'll put the link onto this because it has the details of a letter that you can send to each one of your banks. So we'll circulate that text in our letter and you can copy that. Also, we are organizing a 60-kilometer walk, 1 kilometer for each year of the blockade, which will follow in historic route, the route of 1,400 starving Irish people who were the victims of British imperialism during the potato famine in 1847. We will march under the banner of the British imperialism 1847 equals the US imperialism 2020, and we hope to raise funds to send to the Henry Reeve Brigade. However, we already know that no bank in Ireland will transfer those funds to Cuba because they're all enforcing US blockade under SWIFT, which is really the Helms-Burton Act. we will use the refusal to highlight the tentacles of the blockade in Ireland. We also have the support of members in the Irish Parliament. So that's all I wanted to say. Thank you very much for everyone, and you know, let's all be in solidarity with each other. That's great. Thank you.
Thanks very much, Nina. I'll take Irene Houston from the Cuba Glasgow Film Festival. 1 second while Jacob
got it right first. You got it right first time, Sam. Irene. Oh, am I unmuted now?
Yes, you are. Go for it. Sorry.
Oh, sorry. Oh, thanks, Sam. I'm saying you got it right the first time, Irene. But thanks so much, everybody. I think we've all said that it's been really excellent. And I just wanted to say one of the other things that Cuba is brilliant at, of course, is culture. And I run direct the Havana Glasgow Film Festival with Danny. So Danny and I are working on the next Havana Glasgow Film Festival. This is the 6th one. It's going to be online this year, but I also have Helen's book, and we're going to do a few. I just wanted to say, is Ed still here from Belly of the Beast? We're going to do, as part of the film festival, we're going to do a feature on Cuban doctors and show the film on Belly of the Beast. So we're running in November running November from the 10th to the 15th. Oh, hi, Ed. I've been talking to Reed online and watching your documentaries, and we're going to do, I'm looking forward to working with Belly of the Beast on the Havana Glasgow Film Festival this year. We're going to feature you, we're going to feature Helen's book, we're going to feature Cuban doctors, as well as lots of other films and things. So do follow us on Facebook. And it's Cuba's so, what I'm waving my hands about, I see, culture is such an important part, medicine, science, culture, and thank you so much, you guys, for all you're doing, because that is so important to get all that Cuba's doing in so many different aspects. And film is the way to do it. And speaking as a documentary maker, I'm hopefully be able to support you and help you in the donations for your documentary. I think this is really important, what you're doing in Cuba. So, and thanks to everybody. That was great, all you everybody there.
Thanks very much. So please follow the link for the film festival. Great. Well, I hope everybody enjoyed today as much as I did. Really appreciate all of the speakers' contributions. Again, I think what Helen was saying at the end of her contribution is really important. This is the US blockade against Cuba is tightening, the escalation is increasing, and Cuba needs our solidarity now. And then that leads into what Ria was saying, that it's not just about, solidarity with Cuba, but actually this is a fight for, the future of humanity. You've got the issues with COVID-19, the environment, this economic crisis. So yes, a lot for us to think about. And I hope if nothing else, people will leave this meeting thinking that they want to take some action. So please, take the links down, support the Belly of the Beast in getting their news out, support Rock Around the Blockade in whatever way you can, and get a copy of our newspaper, a subscription to it, and yeah, get involved wherever and however you can.